presentation is on cardiac MRI. So this cardiac MRI are done by, how many of people are aware of this cardiac MRI? So in the cardiac MRI, first of all, you need to know about the anatomy of the heart, no? So the heart is covered with many layers, no? Epicardium, myocardium, endocardium. But more than that, usually we have to know about the cardiac chambers. These are the cardiac chambers. There are 4 chambers in the heart. The upper ones are called as atria and the lower ones are called as ventricles. So these 4 chambers, initially I used to get a doubt when in the initial days of my learning, that when you say 3 chamber, 4 chamber, 5 chamber like that, I used to think, heart will have only 4 chamber, how come these 3 chambers have come in between? So it is the technologist's job that he can make the 3 chambers to visualize. Then I understood later. So like that you also get to understand, when we talk about 3 chamber and all, don't think that there are 3 chambers in the heart. There is one more chamber, but only thing is I am making the slide, I am making the picture so that only 3 chambers can be seen. That is in the hands of the technologist. So out of all the things, I found that doing the cardiac MR is little bit time taking to understand. And you have different valves, that is between the left atrium and left ventricle there is a mitral valve, and between the right atrium and right ventricle there is a tricuspid valve, and the circulation of the blood will be taking place like this. See, both in the left through the left pulmonary veins and right pulmonary veins, the pure blood will come to the left atrium. From there it will be drained into left ventricle. From there blood will flow through the main aorta and various parts will be taken of the blood. At the same time, the impure blood carrying from inferior vena cava and superior vena cava will drain into the right atrium. From there it will enter into the right ventricle, and then it is through this valve it will enter into the main pulmonary artery and will be carried to the lungs. So what we do, we identify the chambers, valves, all these things we wanted to identify. So these are the cardiac MRI indications. Because of the lack of time, that whenever the prescription comes, let you also read at your home indications of the cardiac MRI and you will be knowing. And the contraindications are nothing that is specific to whatever you know, that any metallic objects, all these things are contraindication. No, nothing to tell specifically that this is the extra contraindication for heart. And comes to the patient preparation. Patient preparation should be something like any other examination. Whenever you are doing the contrast investigation, taking the serum creatinine into consideration and making the patient to be on fasting, and the chest shave for the males to be done, because the ECG electrodes otherwise cannot be placed properly. And this way you can place connecting the ECG leads. Connecting the ECG leads, nowadays it is so easy that every manufacturer will give you a suggestion like how to make it. Like in our machine, we have a 3 Tesla Siemens Kyra. So the moment you take this Wi-Fi device to the bore of the magnet, it will on. It will show you with the colors, green, yellow, green, white, red and all. Usually, initially we used to thought it is very difficult to do it, but later with an experience we got that just to make it a L shape, and at the second intercostal space, and then fifth intercostal space, at the dome of the diaphragm, and left side, if it is the left side heart, the axillary line. So just is in L shape, if you could able to place, then it will be ECG gating. Like why you need an ECG gating? Because it is constantly moving structure, no? So it needs to be, the cardiac movement has to be freezed. For that reason only we do the cardiac gating by doing the ECG. Just you are taking the ECG and allowing the machine to take the ECG, and when there is a least cardiac motion, it has to take the scans. That is the intention. It is something like a ECG technician job. But you just connect it, automatically system will take into consideration. Even the scanning also will be triggered when there is a least cardiac motion at the diastolic phase. So this way you can place this thing. Yeah, so this is the ECG pattern you are seeing. So here ECG 2 is something like there, no? So a technologist will identify which pattern of the ECG is good, that he will select. This is called heart rate. This is RR interval. The respiration is on. And so actually when it comes to the MRI of heart, usually we call some different terminologies where people get confusion, called dark blood imaging, bright blood imaging. What is this dark blood? Usually blood is red, no? How it can be dark? How it can be white? So in the terms of MRI, if the blood is appearing dark, that is called dark blood phenomena. It is nothing to do with color coding or in color, you are not going to mix any color into the blood. It is something like by choosing a particular sequence which makes the blood to appear dark. Usually you are aware of all spin echo pulse sequences will show the blood dark, that's it. So when you make the spin echo pulse sequences to make the blood to appear dark, that we call it as with a different word, where making the people to get confused, called dark blood phenomena. For that you can use these sequences like turbo spin echo, turbo inversion recovery magnitude, half Fourier acquisition with turbo spin echo, proof is, of course flash is not there, it is a GRE sequence. So this how you can see here, this is the heart. No, I think anybody can identify this, even the CT technician can identify. This is the heart structure, where this is the left atrium, left ventricle, right atrium, right ventricle. So the blood, how is it appearing? Dark, no? So it is dark blood phenomena. Now what is bright blood phenomena? So as such, you know, if you know the fundamentals of MR, that if you use the pulse sequences called GRE pulse sequences, the blood is going to appear white. That is the same phenomena in the TOF technique of the intracranial blood vessels or extracranial blood vessels. The blood is going to appear white, that is called as bright blood imaging. So GRE pulse sequences like a flash called fast low angle shot, where the left ventricle, this is the right ventricle, how this blood is appearing now? White. So that is only the sequence that you are using. So everything is there in the sequence only. Use a particular sequence. It is customary that we always use both the type of sequences like a spin echo and a GRE, that is both dark blood imaging and bright blood imaging. Then coming on to the planning, this is very important, I can say, where how to take the different, this is the very important thing. See, it takes some time, because even initially when I was learning, in the learning phase, we used to feel difficult, but later we thought it is very easy. So if you wanted to make, see, there are some terminologies like we call it as 2-chamber view, 4-chamber view, 3-chamber view, like that. This is the terminology. So far what you know, either you are a CT technologist or MRI technologist, you know about axial, coronal, sagittal, some terminologies. But here when it comes to the cardiac anatomy, because it is obliquely oriented, the apex will be towards the down and base will be towards the top. This orientation is something different. So we don't call with the coronal, sagittal and all. We use a different terminology called 2-chamber view, 4-chamber view, short axis. They are very important. What is 2-chamber view? 2-chamber view is a view where it will make the only 2 chambers to appear, that is left atrium and left ventricle. So how to do that? See, you take a routine axial scan. On that you plan a section in such a way that it is parallel to the interventricular septum. Then you get the so-called view called 2-chamber view. దీన్ని నేనేం చెప్తుంటానంటే మీకు సొరకాయ లాగా ఉంది అంటుంటాను. సొరకాయ అనుకుంటారు, కొబ్బరికాయ అనుకుంటారు, ఏమని అనుకోండి. చూడగానే దీన్ని గుర్తుపెట్టేయాలి. ఇట్లా ఉంటే దిస్ ఈజ్ కాల్డ్ 2-chamber view. The way that I learned, also I am telling you to learn like this. And when it comes to the short axis is nothing but this 2-chamber view. You can cut vertically from the apex to the base. It is nothing but we get the so-called views called short axis view, which will demonstrate left ventricle, right ventricle, left ventricle, right ventricle, left ventricle, right ventricle in between the myocardium. And 4-chamber, you can cut the 2-chamber view longitudinally, avoiding the aorta, and here you see you get the 4-chamber view. This is called a 4-chamber view, where this is the left atrium, left ventricle, right atrium and right ventricle with the interventricular septum. So you can identify all these 4 chambers, you know. And there is one more view called 3-chamber view, which is you get the short axis, you know. In the short axis, at the very basal section, you get a number looks like 8. ये 8 को आप जैसा ऐसा कट करे तो you get a so-called 3-chamber view. 8 అనే సంఖ్యని మీరు నిలువుగా ఎలా కట్ చేసినట్టుగా చేస్తే షార్ట్ యాక్సిస్లో you get a so-called view called 3-chamber view, called left atrium, left ventricle and aorta. So this is the 3-chamber view. So from the, you see, it is something like one after the other you can come to the another view. Now what is LVOT, left ventricular outflow tract? Whatever the 3-chamber you got, longitudinally if you cut along the aorta and the left ventricle, you get this is the view which is looking like mango lagunda, sorakaya lagunda, sorakaya lagunda. నేను అనుకుంటున్నా సొరకాయ లాగా ఇట్లే ఉంటుంది కదా సొరకాయ, ఇది కాడలాగా ఉంది. సొరకాయ లాగా ఉంటే మీది LVOT, కద్దూస్ కాయ అంటారా, కద్దూస్ కాయ లాగా ఉంటే అది LVOT. So LVOT का ऐसा हो जाता. So the right ventricular outflow tract can be planned in the short axis in the right this way. Okay. Now, so we know 2 chamber, 4 chamber, short axis. Then what is perfusion? Perfusion means something like a dynamic scan. So dynamic scan is nothing but you have to inject the contrast dynamically. You have to perform the scan according to the patient's weight. You have to give the contrast. Usually we practice of giving 20 ml of contrast, and initial phase of the right ventricular phase. This is the left ventricular phase, and this is the washout phase, like that. Then after that, in MRI, cardiac MRI, we do a thing called LGE, called late gadolinium enhancement. That is, after 9 to 10 minutes of the initiation of the contrast, we get the so-called images and all the axes, whatever I told you, like 2 chamber, 4 chamber, short axis. We will be doing this. This is called delayed enhancement. So same chambers we can take it. Okay. So then there are some flow measurements which I will tell you later. I will directly go to the 3 Tesla Skyra Siemens scanner. Okay. Now this is the protocol that we are using in 3 Tesla scanner. Before going to the 3 Tesla, I want to tell you one important point for the sake of the learning technologies, that usually cardiac MRI is better preferred to do on a 1.5 Tesla because it has less artifacts. So not everything is good with high Tesla, no? Like 3 Tesla will also exaggerate some of the artifacts. So that is the reason 1.5 Tesla will be still better. But even then, so you can't buy two, maybe in an institute like us, we have two different machines, but software and hardware is available only with the one machine. So in that case, we have at the 3 Tesla, that is Siemens Skyra, a 3 Tesla. This is the protocol which we are using. Like you have the various sequences. Whenever it denotes with 2CH, it is called 2 chamber, and this is the various scan times and how much seconds it is taking and all has been mentioned here. And in a 3 Tesla MRI, I told you the more artifacts will come. So how to overcome those artifacts? So you have to do a procedure called as identifying a frequency where you can have the least artifacts. That is done by using a sequence called Trophy sequence. So when you do that Trophy sequence, see there are 2 images here, which is in the 2 chamber view. Tell me which image is looking good with less artifacts. Is it the left image or right image? Right image, you know. So here you identify one, there is one value here, 50 Hz. So that is the frequency which you have to put in all the other sequences, all the other cine sequences when you wanted to do it. So this is the extra sequence that you have to do it in the 3 Tesla. In 1.5 it doesn't require. This phase can be omitted. Then now identify, because of whatever I have given you earlier. Now what is this view? What is this view? A 2 chamber view, correct. What is this view? 4 chamber. What is this? Identify this structure. What is this? Head? Left atrium. Idi? Interventricular septum. Okay. So what is this view? 4 chamber view, correct. What is this view? What is this? Okay. So this is short axis, no? Short axis. What is this? Left ventricle. This is? What is this? Papillary muscles, no? Yeah, this is the interventricular septum. Most of the time for the scar and all we look at this place. Okay. Now, of course, it's not exactly the image. Can you tell me what is this view? Left one. 3 chamber. Right one, Sarkaya. LVOT. Okay. This is the turbo spin echo. That is spin echo image, same in the short axis. What is these are images? These images are with contrast or plain? With contrast, dynamics, perfusion. And these are the vibe sequence images. And routinely after doing the contrast, we take from the entire heart, we will take some axial sections, routine axial sections with contrast, with volume interpolated breath hold examinations. That is vibe in Siemens. What is the similar sequence in GE? What is the similar sequence? Vibe is what is there in GE? Siemens dash in GE. Cube or lava? Then flow Wenck's count. Flow Wenck's, when you wanted to measure the flow across the vessel, we have to perform a particular slice exactly over the LVOT, and we have to measure the flow wherein you have to find out about an artifact called aliasing artifact. Aliasing artifact. So the blood vessel should supposed to appear like a, which is on the left side, no? So that round aorta, no? It should be like this. But you see on the top, I put it as a red mark where there is a black and white is there. So that is called as aliasing artifact. You have to avoid that. Okay. So this you can identify one value here. That value you should put it for the next images for finding out the flow velocity across a blood vessel. That is for flow quantification. And this is called TI scout. TI scout is a scout where with the different TI value. What is TI? TI is nothing but time from inversion. See here, left ventricle and right ventricle in between, the myocardium, where the myocardium is looking too dark out of 4 images. Is it in the first image, second image, third or fourth? Fourth image, it is looking more dark. So exactly at the side, the machine will tell you at what TI value that is becoming nullified. So that value you have to put it and repeat in the 2-chamber, 4-chamber short axis. That's it. Okay. And again with the PSIR sequence, phase sensitive inversion recovery short axis. These are the phase images and all these things. 4-chamber, high resolution image in short axis. The flow quantification which we are doing at the aorta without having the aliasing artifact. And in the net, if you see, you have a chart. Initially when you wanted to learn the cardiac MRI, take these images, put it aside and try to manipulate in such a way that you are going to get a particular 4-chamber or 2-chamber. You can practice in this way. Or in the cardiac CT if you have, because that is also a volume acquisition, these plans can also be learned even with the cardiac CT because it is a volume CT.